Instead of going to the doctor to get pain meds, go see a massage therapist and work out that strain or that sprain or that back issue instead of burdening our physicians.
How can a set of skills lead you down the path to success? That's what we're setting out to answer on the Ed Up Canada podcast. I'm your host, Michael Sangster. Join me as we unpack how leaders around the world have taken training and skills and turned that into a lasting career. Now let's learn together. Welcome back to the Ed Up Canada podcast. I'm Michael Sangster, your host, and I am excited to be back here. I'm always excited to be on the podcast because I enjoy the conversations and the opportunity to get to know people. But here's a couple of ladies from Nova Scotia that I've had the pleasure of knowing. Jennifer Stewart and Natasha Joyce. Natasha sits on the executive of the, on the board of directors of the National Association of Career Colleges. And they're both principals, partners, troublemakers at the Canadian College of Massage Therapy, Massage and Hydrotherapy, right? So let's start off. What's hydrotherapy, Jennifer?
Hydrotherapy, it's officially the use of water in all its forms for therapeutic value. So using liquid or gas or steam or ice for treating injuries.
For drinks? Does ice and drinks count?
Yes, of course, ice and drinks count.
That's hydrotherapy? Okay, that's good to know.
That is hydrotherapy, yeah.
As a proud Scotsman, I'm proud to say there's no ice in my scotch, but it goes in some other drinks. Natasha, talk to me about the college. How long you've been in operations? Give me a little bit of the background about the college.
Yeah, so CCMH has actually been around since 1946, actually. So one of the legacy schools for massage therapy. So we are currently the only CCMH campus here in Canada, actually, in Halifax. We have a massage therapy diploma program, a regular track, a fast track, and we also have an online blended program as well. So people that are not necessarily currently in Halifax can still start our program and take that in from anywhere here in Canada or internationally as well.
And then do they come in to finish the program?
They do, yes. So they do a couple years online, which is all of the health sciences that they do in the professional practice. And then they come on site to blend into our current class to do all of the hands-on and the practical piece.
What's the diploma program? We're diving in deep really fast, but what's the difference between the different levels of programming?
So it's all a 2,200-hour program. So regardless which kind of route you take in our program, it still will get you the massage therapy diploma at the end of it, which will then give you access to be able to practice as a massage therapist in any unregulated province. And then you can also go and do your regulatory board exams and practice in any regulated province as well.
Jennifer, talk to me a little bit about upkeep of your program. You've graduated 5 years later. What kind of upskills? I was at your college recently. You hosted the King's Coronation Medal ceremony for Halifax, and it was a great location to show off what our colleges do. And across the hall, there was some training going on, wasn't there?
There was, yeah. Those trainings are called continuing education or professional development. And just like any other healthcare profession, massage therapists have to do upkeep or continuing training to maintain their license to practice. So when you were here, there was a myofascial release course going on. This month, there's all kinds of stuff going on in April and May here. We've got manual lymphatic drainage. We just had a rapid course happening. There's a gal coming down from Ontario who's really well known for oncology massage. We often have craniosacral come up from the States to teach. So our classrooms lend really well to professional development because our desks are all massage tables and the school's set up for practical classes. And that's what most professional development courses are when they happen in person.
I have to check. I think I've let my manual lymphatic drainage certification slip.
Well, there's a level 1 coming up next week.
I'll have to get on that. I have no idea what it is, but it sounds important. So I want to stick with you, Jennifer, because you used a word there, healthcare. Being a bit cheeky, because we went through some interesting accusations from the Minister of Immigration, Mark Miller, last year, where he mocked massage therapy, as if it wasn't, that our colleges were above massage therapists, massage parlors, actually. Talk to me about the importance of massage therapy. Take a little time, Jennifer, about its importance in healthcare. I heard you just use the word oncology, right? It is truly part of our healthcare system, isn't it?
Yes, it truly is. I mean, I went to the original CCMH campus when it was in Sutton, Ontario, back in 1992. And even then, there were a lot of misconceptions about massage therapy, and the locals in the town called us rubbies. So it was, it takes a little bit to conquer those and to educate your patients and your friends and your family about the fact that we are therapists and we're not masseurs or masseuses, and there's no sort of basement dweller parlor that we're aiming to open. We put in a solid 2 years of education, and we go on to do professional qualification exams or regulation exams in provinces that have massage therapy as a regulated health profession. So I would say that any comments, especially made by a politician, are made in ignorance of what our healthcare system has grown to be. And I don't feel in my 30-year practice like I really had to spend a whole lot of time defending who I was or the integrity of my profession. I think that most people, the general public, are very well informed about what massage therapy can do, especially now. There's enough of us out there. There's probably 20,000 plus massage therapists in Canada. So that's a lot of people that are practicing healthcare, and a lot of patients that have seen the benefit of massage over the years. And we work alongside physios and chiropractors and acupuncturists and kinesiologists, psychologists, etc. There's a ton of massage therapy research out there that proves or at least supports our profession, and the techniques that we put together, our treatment planning and our assessments are right up there along with physios and chiropractors. So I don't think that it's really a question anymore, maybe for older generations, but certainly the younger generations and the students that are coming into our program have had enough exposure and experience with massage therapy that we don't have questionable applicants that are coming in with less than positive intentions for their education.
I couldn't agree more. And I'm glad you went in a little bit more depth there to talk about massage therapy and it's important inside the healthcare system. So let me flip over to you, Natasha. Talk to me about the job need. What kind of careers are coming out? I know you mentioned when I was there, and a beautiful campus. You mentioned the job opportunities and the lineup of students that are coming, but what do the jobs look like?
Yeah, so our students coming out of the massage therapy program can have a job immediately. So most students actually during our career fair that we generally host in February will actually have job lined up and contracts already beforehand, because here in Nova Scotia specifically, we're crying for massage therapists. There's on any given day, I would say we have 10 to 15 clinics reaching out to us asking for massage therapists, asking what our students are going to graduate, because we're in such a need. Especially if you go to more rural areas, sometimes the waiting list for a massage therapist can be up to 2-3 months to get in to see somebody. So the need is definitely there. And also with massage therapy, it's great because you can expand and you can specialize in certain areas. So, Jennifer mentioned the manual lymphatic drainage or the fascial side of things. So therapists can specialize, and then we have all of that access for our patients.
What kind of practical experience do they get while in your program?
Yeah, so in our program, we actually have 340 clinic hours. So they're actually treating the public for at least 340 hours in that 2 year program. So before they even graduate, they've had experience treating people with neurological conditions, arthritic conditions. They've been treating people in a sports environment, invisible illness. We also just recently started a queer and trans health community clinic as well. So students can also get some experience treating different populations groups and being accessible.
And that's right on campus, that practicum, or is some of it outside the campus as well, inside employers?
Yeah, so for the majority of our clinical practicums, they're actually hosted here on site at our campus. We do have a few outreaches that we will go to. We go to an enhanced care facility. We go out and do special events, so some sporting events like the Blue Nose Marathon and different avenues like that. So we do some off-site, but we do a host of them here at the campus.
So if I'm looking at one of your programs here, and it is exhaustive. Jennifer, talk to me a little bit about the 20 months, the regular track coming on site. I know you've got a couple of different options, but how many hours is that total?
It's 2,240 hours total. And the 20-month program is actually, it's still 16 months, but we count the 4-month break between first year and second year. So it looks like 2 regular university years with the 4 months off in the summer. It consists of health science courses, so all the human anatomy and physiology and pathology, head to toe. It's very, very thorough with respect to musculoskeletal anatomy. And we also tease out the nervous system, and we do a special neurology course so that we can better understand peripheral nerves, especially. And then we have clinical sciences, and those are all the fun courses. That's all the assessment courses and the treatment courses. Hydrotherapy is included in that, therapeutic exercise. And then what are called the professional practice courses. And these are the, therapeutic relationship, ethics, communication, boundaries, all the legislation that massage therapists need to practice under, research literacy, and business. We teach a business course as well.
How long is that business course? Because many of them do become small business operators, don't they?
Yeah, they do. So it's about 20 to 24 hours of business. So we talk about how to work for someone who owns the clinic, so as an employee, or be on contract as a subcontractor or an independent contractor for someone else who owns the practice. But we also teach entrepreneurship, and we do business plans and talk about what it is to set up a massage therapy practice on your own, or hiring others, or working in co-ops. We look at all the options.
So we're going fast and furious here, but I'm going to jump over to you, Natasha, and ask you the regulatory environment. So you've got provincial regulations, and I'm assuming because you've got some kind of a certification or provincial exam as well.
So here in Nova Scotia, actually, because we're an unregulated province for massage therapy, there's actually no regulatory exam that students have to take in order to practice here in Nova Scotia. So once they actually graduate from our program, they can go right into the workforce immediately. That being said, we do have what we call comprehensive exams and OSCEs at the end of our program, and it's an exam to kind of test them on the whole 2-year program, and it also prepares them that if they decide to go to a regulated province and do the board exams, that they're prepared for that. But here in Nova Scotia, there's actually no exam that they need to take.
So that's one of the things we're facing is interprovincial barriers. So for one of your graduates, they will have to, if they go into Ontario as an example, take the certification exam in Ontario.
Yes, that is correct.
Okay. So that's an important thing for people to understand who are enrolling in the program who might want to move elsewhere. Are massage therapists in other provinces graduate? Are they fairly freely accepted in Nova Scotia to operate?
Oh, absolutely. And especially coming from a regulated province, again, there's no exam to practice here in Nova Scotia. You just have to join an association and get insurance and things like that. So there's actually no issue with people coming from a regulated province to practice here in an unregulated. The issue becomes when you go the other way.
But let's be clear. You are regulated by the province to operate as a college, and they do keep a close eye on you and your programs and everything that you do, don't they?
Oh, yes. From a Department of Advanced Education side of things, yes, as a regulated career college, we are very heavily regulated actually on the government side of things to operate as a college. It's just within the profession that exam happens, or it does not happen, I guess, here in the Nova Scotia.
Jennifer, put you on the spot here with a question you're not going to expect, but there's something special about career colleges and the way we teach and the class sizes and the way we operate. What makes your business partner special? What makes Natasha special for sponsors? For students?
Wow. For students? Oh, wow. Well, Natasha has many qualities. One being she is an incredible instructor. So Natasha is a graduate of this school. She graduated from this school, this campus. I taught her. She sat in the front row, was incredibly studious, and one of the top grads. So honor roll, and really impressive student. Now she has climbed the ladder from being a teaching assistant to being a lead instructor to working on administration to then being asked to join me to purchase the school back in 2020. She does many roles here. She acts as financial aid officer, director of education, student services, and she's still in the classroom teaching because she's that good at it. We can't keep her out of the classroom.
Good to keep that connectivity too, right? With everything else to understand what's
It's
going
good
on
to
in the
be on
college.
the front lines. That's right.
Ironically, at our board meeting, she sits in the back row. So apparently over time she's learned, but on occasion we've been out late the night before. So
Yeah.
let me turn that around on you, Natasha, then, and have you talk a little bit about Jennifer, because you two are a special partnership, aren't you?
Yes, we really are. Just as Jennifer mentioned, she was my instructor when I was a student here at CCMH. And, that's one of the first things I remember coming in and, the Miss Frizzle effect almost. We're talking about it, neuroanatomy, and we're walking down the side of the road, picking up neurons here and there. And it just opened up my eyes and gave me such a passion for the profession and for the sciences. So I had that really unique relationship with Jen. And as I kind of came up through and progressed into different roles, she acted a bit as a mentor for me and helped guide me through this process. So really helped encourage me and help my passion for education and for the sector really grow. So yeah, she's wonderful.
Very strong Miss Frizzle reference. Didn't see that one coming today. So Jennifer mentioned the student aid piece. Talk to me about student aid, Natasha, and how important that is, but more importantly, what opportunities exist for students to enroll in your programs.
Yeah, absolutely. So, with regards to financial aid, again, given the state of our economy, student aid and financial aid is definitely something that a lot of our students need to seek out when coming into our program. So, there's multiple different avenues that they can take. There's the Canada Student Loan and Nova Scotia Student Loan route that students can apply for, which automatically will make them eligible for grants through the government as well. Here in Nova Scotia, we also have a skills funding program where people with maybe if they were on EI could actually get full funding to go to school. You can also get funding through Veterans Affairs, the Native Council as well, AbTech. So there are a lot of routes that students can take to get financial aid other than just going to a bank and getting a student loan or some sort of very high interest loan from them.
The other important thing to consider there is to come in and meet with somebody like you who knows the system and can help to make sure that you're right. Someone is guided in the right direction. But let me just challenge you on one thing before you go on. I'm going to guess, like most other colleges, you turn down students too, though, because you don't find the fit for someone who's going to be successful to complete the program, correct? And you've only got, because this class sizes are small, you only have so many spaces. Am I right?
That is true. Yes. And, we don't want students to waste their money either if they're not going to be the right fit for the profession or for our college. We actually, here at CCMH, have a prerequisite course that we actually require that all of our prospective students take. It's called an Introduction to Massage Therapy. And it's a little weekend course where they actually get to put their hands on and practice some massage therapy techniques so they can decide if the program is right for them before they even enroll into our program and go down that route of, potentially wasting their money or their time.
And the reverse side too is a space for you because you've only got so much room to train, right? So you want to find people who will be successful. Jennifer, talk to me about your clinics. You're open for the public to come in to get massage therapy, but that's also important training for the students, isn't it?
It is. Yeah. That's where the rubber hits the road, really. So when we have our public clinics, they're in the evenings after classes. So the students have already been through a full day of classes. And then if they are in that clinic shift in the evening, they start about 15 minutes after class ends, preparing for clinic. And then they treat 2 patients in the evening. And if they work Saturdays or every second Saturday, they treat 4 patients. So these are folks that are coming in from the neighborhood and from the building that we're in that have any number of conditions. So they really represent the patient population that student is going to see once they've graduated. And they have a supervisor that's one of our faculty that walks around and visits their cubicle or their clinic space while they're treating the patient to see if they have any questions, check out what they're doing, check their ergonomics, their hand placement, ask them what assessments they've done. ask them what they're doing and what their plan is for the treatment. And then the student finishes up with that patient, gives them some home care advice, recommendations for future treatment. And then they do all their charting and all their paperwork. So it really is the true experience of what it's going to be like for them as a therapist. And the students, for the most part, other than a long day, they really enjoy clinic shifts. That's their favorite part by far.
And invaluable skills
Absolutely.
to be able to provide these healthcare services. So before we get to our big final two questions, we ask every guest. As you've probably noticed now, ladies, we do this fairly informally now. We used to be very formal and we'd write questions. And I had the pleasure of interviewing Peter Mansbridge, and he threw my notes aside and said, just talk to me, listen to me and talk to me. So that's what I've been kind of doing today. But on that note, is there anything you two want to talk about? A message you want to get across you haven't had a chance?
I think things are really exciting for Natasha and I right now. We're coming up to trying to make a decision at the end of our lease here at this space, which we truly love, if we're going to buy and renovate or build a building. This would be one of the first standalone colleges for massage therapy training. So we're really excited about that. We've adopted a reflexology program that we're really proud of. That's professional development for massage therapists. We're looking at a couple other programs to develop that will be somewhat in the same field of healthcare and some not necessarily occupational training, but again, more professional development for massage therapists. And next year's our 80th birthday, so we'll be doing some celebrating.
I was just going to say that I'm just doing some math here on the piece of paper. I thought it went up to 80 next year. But before I go to you, Natasha, there's about 5 things you mentioned, Jennifer, and every one of those involves money out of your own pocket and risks that you're going to take, right?
Right.
I wish more people understood that about our sector when they make judgments of us. And while the start of the year last year was difficult with the federal government's announcements and their language around our sector, by the end of the year, we kind of turned the corner that people were saying, wait a second here, they're not the problem. They didn't have the large number of international students. They had some, very few. But I think there's a better understanding about the personal risk and investments. You're talking about buying a building. That is no small feat. And that means everything you've got in your building now has to be rebuilt somewhere else. And I've been in your labs, which we turned into a presentation room to give away medals. And it kind of worked out perfectly. But like, that's no small amount of money, is it?
No, it's not. You want to invest?
Yeah, I'm good right now. It'd be a conflict. Jennifer, otherwise I'd be there for you, but it'd be a bit of a conflict with the other colleges. But Natasha, is there anything else that you want to just talk about? Even maybe your time on our board or things that we've got going on, right?
Yeah, for sure. I'm super excited to be a part of the NAC board for sure. I think, collaborating with other college owners and other educators has really been invaluable, even for my own business, to help kind of direct how we're making decisions and what's working for other colleges. And also that the work that we're doing on a national side of things with regards to promoting that international student, making people realize that we weren't the problem. We're actually the solution to the labor market issues. So we can be that solution. So being a part of the board and a part of that organization really has been super beneficial. And I hope we can continue to do that kind of work and promote that kind of messaging, not just for massage therapy, but for the industry as a whole as regulated career colleges. On the massage therapy side of things, something I'm really excited about is the fact that we're, looked at a little bit more like healthcare. And, healthcare has been a really big topic right now and trying to fix healthcare and how can we fix healthcare? And, things like massage therapy, chiropractic, physiotherapy, we can be some of the solution for that as well. Instead of going to the doctor to get pain meds, go see a massage therapist and work out that strain or that sprain or that back issue. Instead of burdening our physicians, we can be the solution along with other allied healthcare professionals like chiros, physios, acupuncturists, and things like that. So it's exciting to see that starting to come to fruition as well.
Fantastic. And I appreciate your commentary because I think it's important. You've played a good role in the national executive, but you're also the president of the Provincial Association, and that's keeping you busy. And I should note for the crowd, both of you are now King's Coronation Medal recipients. It was an honor to present that medal to you alongside the minister from the Nova Scotia government who joined us to present those medals, and you both are very well deserving as nominated by your fellow members. We just finished a national tour, and we started in Halifax, then we went over to Newfoundland, then PEI, Ottawa, Gatineau, Quebec, Toronto, Edmonton, Winnipeg, Vancouver. We just got Edmonton, just have Saskatchewan to finish up, and then a ceremony in New Brunswick. So it's been really cool to go across the country and present these medals to people like you who have deserved it. Make a guess. How many students do you think you've touched? Is that the wrong word to use?
No, that's quite good. That's the perfect word.
It's part of the pun of the massage therapy world. But how many students have you impacted over the course of your careers?
Thousands.
Yeah, thousands.
And that's what I wish was better known in small class sizes with very attentive, focused education. I was in your space. It was very cool little areas for people to sit and just go down and have a little downtime. And it's greatly appreciated. So we usually ask 2 questions to finish. I'm going to split them up. So I'm going to start with you, Jennifer. Talk to me about a skill that has made you successful.
That's the one I didn't want.
Well, you don't get to pick. You're going to make you talk about yourself.
Okay. Skill that has made me successful. I think when I think about adult education, I think about it very practically. So I think what has made me successful is understanding that how adults learn. So adults cannot be surprised. In the classroom, they need to know what's expected, and you can't, pull a pop quiz on them. You can't change the rules partway through. So when you have a plan in place for a class, you have to stick with that plan. And I think that that's taught me on many levels, whether it's planning for a class or planning for a faculty or running the school on an administrative level. It's taught me to plan and really consider how I want to go forward with something so that I'm not surprised partway through.
That's a really interesting perspective, and one that could only come from a career of work.
Right?
That's not something you get out of a textbook.
It's not something you get out of a textbook. And the other part of it is, the other thing I've learned about being an adult educator is that you don't gain a group's respect just by showing up or standing in front of them. You really have to earn it. And that comes from being a good listener and understanding the learning environment or the learning space, and really trying to empathize with where people are at and meeting them where they're at and not taking a lot of it personally.
General Rick Hilliard taught me a lesson one time. Respect is earned in inches and lost a mile at a time.
Right? Exactly.
And it's the best description I've ever heard of it. He compared it to a wave. It comes in slowly, but it goes away faster.
Well, he would know, right? He's having the long and successful career that he has.
Yep. Yep. But I do pick on him because he is a Leafs fan and continues to stick with that. And I'm hoping he listens to that. So I'm going to go to you, Natasha, for the big question to talk about who is a mentor who's impacted your career.
Mm-hmm. And that is a great question. I don't know if I can really pinpoint one specific mentor that had like a singular impact on my life or my career. It's been kind of more of a collection of people who've contributed in their own little way. So over the years, I've been fortunate enough to cross paths with different individuals, teachers, colleagues, leaders, and even my friends as well, who've offered some sort of support, shared wisdom, or led by example, which I find the biggest one when it comes to mentorship. And each of those interactions, whether they were like super small or large, I feel like they helped shape my perspective and growth, not only as an educator, but also as a business owner, because there was a big learning curve in that piece. I'm really good with the education. I've been learning my way around the business side of things. So it's really been more of a mosaic of mentorship, so to speak, rather than like one specific guiding figure.
Interesting perspective. It's funny, every week I've said this before, I come up with a new one. Somebody's have a different impact in a different way. So you said it the same way. So before we sign off, Jennifer, you can talk about a mentor because you were dying to.
Oh, dear. Well, you know what? I thought the same way as Natasha at first. I couldn't find one person that, you often think of teachers as mentors, and And I didn't really have one particular there are lots of teachers that I loved, but what they did for me was give me my passion for education. And then being in the education industry, my mentors have been my students. I always look at a group of students or a class as having collectively, they have way more life experience than I have, even at my ripe old age. And they know a lot more collectively than I do. So I have learned every single term I enroll a new group of students from them collectively more than I have from my own teachers. So my students are my mentors.
That's an awesome answer, and it speaks volumes to the kind of institution you're running. So I got to put Natasha on the spot.
Okay.
We're talking to a student who's walked in the front door and they're trying to figure out their path. Tell them why they should go to a career college.
So I believe that students coming to a career college should come here because that is our sole focus, is to train those individuals, put them in the workforce right away, none of the fluff, but get right into the nitty gritty of things, give them the skills they need, and they get out the door.
Wow. Didn't warn you about that question.
Yeah.
And for those of you listening, didn't warn her any of them about either one of the ladies about any of the questions.
Caught me off guard with that one.
But you get a much more genuine answer. And I think that's a great description of what I've seen. I've had the pleasure of touring a lot of colleges. I'm drinking from my CCMH coffee mug right now, enjoying my coffee. And it's a great institution.
Yeah, we're really like a family here.
Yeah, it was very obvious from the staff room. I went back and sat in for a couple minutes and enjoyed watching the people interact. So I look forward to being back. And I chuckled too, because one of the other accusations was that we're set up in strip malls and your college is in a mall, but you're there because
a professional center, actually.
the students are there. But there's a mall connected, right?
There is.
But the students are there. The parking's there. The transit's there. The jobs are there. They may be working part-time in the mall. Come study there, don't they? Right.
Mm-hmm.
Yeah. So I wish people would be a little less judgmental, a little bit more upfront about just coming in, taking a look and see what we do. And I think they'd be blown away if they walked into your college. I know the minister was. I know the regulator enjoyed being there. Jeffrey talked about doing a spot audit, but he didn't. So, any last messages, ladies?
Really appreciate you asking us to be on your podcast, Michael. It's been a pleasure.
Oh, I appreciate the opportunity. And I do have to apologize this episode. Ian Ferris and Patrick Dion were supposed to join us one of these weeks, and we have been able to make it happen. But gentlemen, we will make that happen. And that's a tip of the hat to two people we do want to have on. So I appreciate both of you being here with me today. And with that, we'll sign off again for this week's edition of the Ed Up Canada podcast. And we'll be back again next week with more content. Thanks. Thanks for listening to another episode of the Ed Up Canada podcast. We release new episodes regularly, so make sure you hit that subscribe button so you know when they are officially out. If you love this episode, please leave a 4- or 5-star review wherever you listen to your podcasts so that others can also discover how a set of skills can lead to success. Thanks for learning with us.